If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
I became almost antisocial.
I couldn't eat almost anything.
I was having a hard time.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
There was no pain.
What pain?
I can eat everything. It's unbelievable.
I don't have to put all the goo on.
With these, I can eat everything.
But now, I can socialize.
I don't have to worry about being embarrassed going to a restaurant.
It's the best decision I ever made.
It hasn't made my life easier, it sure has.
The mini implants are the only way to go.
It's been fantastic.
I don't know what else to say except it was almost a miracle.
It's just so much better.
I'm happy. I'm very happy.
It literally changed my life.
My dental implant has changed my life.
I feel like me again.
My confidence has really gone through the roof.
I love it.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We're going to talk about the mini dental implant and how it can change your life. You can be you again. Dr. Rose Magno from San Francisco East Bay Mini Dental Implants. You can find them online at sfeastbayminis.com. That's sfeastbayminis.com. Dr. Magno, welcome to the show.
Thank you for having me.
Yeah, and we're going to talk about the mini dental implant, and one of the reasons that I think it's so amazing is you have an example of a conventional older implant versus the mini and the difference in the size of the hole that's drilled. Let's show that example and explain why it's so important.
Okay, well, I used to do conventional implants, and that was when you had to drill the hole 6 times in order to place the implants, and then you'd have to wait about 3 to 6 months to put the implant. But for the minis, you can place the implant the same day with the crown. You may not even feel it.
Look at the difference in that, everybody. The size of the hole for the conventional implant versus the size of the hole for the mini dental implant is so dramatically different, and the healing time is much less because the mini dental implant is 5 times less. It's less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And let's show a lower denture example, Dr. Magno, and why the mini dental implant is so important.
So for our office, we can place 4 or 6 implants depending on how much we would need to snap on the denture. So here's your denture, and then we would snap it on like so, and then it
stabilizes.
It's stable.
Yeah.
So if the patients are complaining that they don't have a denture that stays, then this is helpful for them.
Well, and I would imagine that, you know, we're so used to the lower denture where it kind of swims around on the gum a little bit, and you have to use that adhesive to keep it into place, and that adhesive you end up probably swallowing and eating. It must taste terrible. And now the mini dental implant will stabilize with that titanium post. It locks it right into place.
Exactly, that's right.
So I would think your patients feel a sense of confidence knowing that they won't have a problem with their lower.
They can start eating an apple, steak, and talk properly and play the instruments like they used to. That's
interesting, yes. So if you're playing an instrument or you're speaking, how your denture fits can impact your life in many, many ways, including loving all the food that we love here in the East Bay and here in California.
I had a lot of difficulty in eating.
I'd had to keep away from certain food.
I couldn't bite down on anything.
I wasn't able to eat solid food. I was very self-conscious, and I lost about 40 pounds.
But with these, I can eat everything.
It was done, over, done. Go home and eat.
I can eat steak, I can eat sandwiches.
I can chew a steak. I could not do that before.
I can eat everything. It's unbelievable.
And my teeth aren't falling out of my mouth.
Just a whole newfound sense of security.
I can eat anything I want. I'll smile at anybody, you know. It's outstanding. I'm happy. I'm very happy.
Problem is, I'm getting back the weight I lost.
Now we're going to talk about an upper. We talked about food. Dr. Magno mentioned that sense of taste is going to come back. Show us why with the upper denture.
So for the upper denture, you don't need the palate anymore because that's what used to hold the denture in place. But now you can just have the implants placed, lock on the denture over it, and it stays that way. And it's not as bulky as it used to be.
When we talk about the palate, everybody, we're talking about the plastic piece that's now exposed. You see that kind of, this is right here, that plastic piece is gone, And now the sense of taste that exists in the upper part of the gum is exposed. So
Right.
hot, cold, sweet, salt, all of that is now back.
Yeah, patients say that they're able to taste their food better.
Yeah, and the upper denture I know has that currently because it's kind of a suction that keeps it in place, but the mini dental implant replaces that need because it locks into place.
Yes, and then also one thing, in our office, I make sure that my dentures look natural.
Yeah.
So that's a big difference in our office.
And you work with the patient when they come in, if they have a denture, and if they need the mini dental implant, you will make that work for them.
Right, if they have their own dentures that they're bringing, I can make it so that their existing dentures doesn't move around.
Yeah. So Dr. Magno, we just looked at an upper denture example, but now, God gave us our baby teeth and our adult teeth, and now you're going to give us a third set of teeth. Show us that example and how it relates to the denture.
Okay, so if a patient doesn't like all this plastic, and they don't want to keep taking it in and out, I make the bridges. So these are cemented on while these are snapped on. So here's the difference.
Then no plastic, just like your real teeth.
Yes, it'll feel just like your real teeth.
So that really is a step up. So if somebody's out there and they're looking to make that investment in themselves, to look and feel their best, then that would be an upgrade that would really make a big difference.
Yes, patients are happier with this, but if cost is an issue, then you use this.
Sure, absolutely. And we want to make sure that it's an affordable procedure for everybody. And I know, Dr. Magno, you work with the patients in that respect.
Yes, we offer financing to help pay for their treatment.
Yeah, I mean, we're used to paying for our cars on time, or, if there's a mortgage for your property. It's not going to be that expensive, but it's something that Dr. Magno and her team at Emeryville Dental will work with you on to make sure that you can have your life changed with the mini dental implant.
But this was really affordable.
Yes, it's totally affordable. It's totally affordable.
I would definitely recommend mini dental implants to everyone.
Very happy with it. It looks natural, it feels natural.
I wish I would have got it done a long time ago.
The mini implants are the only way to go, as far as I'm concerned, and I've told numerous people.
It'll be the best, smartest move you ever made.
Mini dental implants have changed my life.
It's the best decision I ever made, so it's well worth it.
Now, if there's a single tooth or a bridge, I know that, or a side teeth in the back, I know that sometimes can be an issue because people have teeth in the back and they ignore it. They don't have their teeth and they figure, well, it's out of sight, out of mind. But no, the mini dental implant can make a difference.
So we've replaced bridges and missing teeth in the back with minis. So we would place the individual minis, and then you can have a bridge like this, or you can have it individually placed so you can floss better.
And I think that's important. You mentioned with some of your patients, they want to get this procedure done. They want to floss their teeth. They want to feel as if it's natural again.
Correct, yes.
Show us the single tooth option because this is custom made for the patient.
So as you can see, the teeth look natural, and we try to match as best we can with the color, and we place this in the front, and then you just snap on and we cement the single tooth.
And that tooth is custom made for the patient.
Absolutely.
Yeah, and it's a made in America product, so it's not something where a tooth arrives in a box and you just put it in. It's custom designed to make them.
It's engineered. It's engineered.
That's right. We should mention that the mini dental implant is engineered so that you can look and feel your best. And you have something that I think is important to note in that this only happens in 1 or 2 or 3 visits versus a conventional implant that takes months.
Yes, because of the less trauma to the bone.
And the implant is engineered, as we said, for the patient. And I know that you have a consultation and an x-ray, and the fee for the consultation and the x-ray would be sort of put toward the mini dental implant. What do you look at when a patient comes in for the consultation?
Well, first we ask them, what do they want?
So you offer the consultation to find out exactly what their dental needs are.
Right, and then we do an exam, of course, and then I could determine what would be best for them.
And when people come into your office at San Francisco East Bay Mini Dental Implants, and you can find them online, by the way, at sfeastbayminis.com. That's sfeastbayminis.com. Dr. Magno and her team are at 6001 Shellmound Street, Suite 125 in Emeryville, California. The phone number, by the way, is 510-595-1900. Call or text today to make an appointment. I know that, as we said, you work with them, but you have all ages of patients that come in, and a lot of younger people come in. And when they come in, I know they want to look their best and feel their best. And in addition to that, you really specialize in painless dentistry. I know that's very important to you. Why is that important?
Because I think half of the country are fearful of dentists. So if we can treat them with less pain and easier for them, then they would enjoy coming to our office.
Even if it's for just a cleaning or a treatment or something like a mini dental implant, because you also do full mouth reconstruction.
Yes.
That's quite an undertaking.
Yes.
Yeah. And with that, I know, we should get to know you a little bit. Where did you grow up, Dr. Magno?
I was born in the Philippines, and I came to America when I was little, and I was raised in the Bay Area, and I finished growing up in Hawaii, and came back here.
Beautiful place. You've been in all these beautiful places. And where did you go to school?
I went to school in Berkeley, and I went to school in UOP Dental School in San Francisco.
How long have you been in practice?
Over 20 years.
Yeah. But you keep up, and I think that's very important, because one of the areas that we talked about is that you work with someone if they have a lisp.
Okay, so there's a lot of Asians and a lot of people from the Middle East that have a lisp. They think it's their accent, but it's not. It's a lisping problem. And I can fix that in 5 to 10 minutes, and it's really life-changing.
You had a story of a patient who had a lisp fixed, and it was very critical because of his job. That was a fascinating story.
Oh, you mean the paramedic?
Yeah.
Okay, so yeah, he wanted to say 44, and I said, because he couldn't say his R's, and I said, why do you want to say 44? And he said, well, so I don't give the people the wrong direction, so to get to the place where he needs to be. So it took about maybe less than 10 minutes to get his work done, and then he called the office later that day to let me know how he was doing, but he wouldn't tell my workers who he was. And when I picked up the phone, he said 44, and he hung up on me.
So you knew then and there that it worked for him. You helped change his life.
He loved me since then. No.
Absolutely. Well, Dr. Magno and everyone at San Francisco East Bay Mini Dental Implants is very special, and we should mention that you're involved in a lot of different organizations. The International Academy of Mini Dental Implants, the American Academy of Cosmetic Dentistry, the American Dental Association, California Dental Association, Alameda County Dental Society, Punjabi Dental Society, Asian American Dental Outreach, and Filipino Dental Practitioners of California, just to name a few. That must make you feel proud, particularly when you can help so many people.
You know, I'm a lifetime student, so I always want to learn different things, learn what's going on in the field of dentistry, because I love my job, and so I want to, do the best and, find the best for my patients.
I cannot tell you what a difference the work you've done on my mouth has done for me. It's like I have a whole new mouth.
No pain, no nothing like that. It's fine.
It was hurting before I got it taken out, but now it feels way, way better.
Awesome.
No pain at all.
Just so impressed with the way my new mouth looks.
I'll send everybody over here.
You did a wonderful job. Thank you.
You're welcome.
The end result is just amazing. Thank you.
She has not seen her new smile yet. Here we go. Don't cry, okay?
Okay.
You gonna look?
Oh my God.
Model.
I might have to buy some lipstick. Oh, I love it. I love it.
And keeping up with technology, there's a dentist in Buffalo across the country. You fly over to the Great Lakes, to Western New York, and you connect so that you can learn about the mini dental implants. Tell us about Dr. Todd Shatkin and how you connected.
So I met Dr. Todd at a UOP lecture that he had, and it just made sense to me. The minis were a lot less traumatic, it's simple for the patients, and it's quick and easy. So that's when I decided to change my practice from conventional implant to minis.
So if you're watching out there and you're thinking maybe you're a candidate for mini dental implants, you can go online at sfeastbayminis.com. That's sfeastbayminis.com. Dr. Magno and her team are at 6001 Shellmound Street, Suite 125 in Emeryville, California. And the phone number is 510-595-1900. Call or text today. Like, subscribe, and follow them on Facebook at SF East Bay Minis. Follow them on Instagram at SF East Bay Mini Dental Implants. Follow them on X at SF East Bay Minis. And like and subscribe to them on YouTube. And what I love about your X handle is that you communicate almost on a spiritual plane sometimes with people. You communicate your thoughts and how that would relate ultimately to helping them. So it's not just about dental, it's just about helping people. How important is that with the audience that's out there? Because I know they like to, we have a lot of IT folks here in the audience. They like to click and get their links and connect on social media. So it's a part of the conversation.
Dentistry is a passion, and I love dentistry. So I want to bring people to know that they're going to a dentist that cares about their health, not just physically, but also on a spiritual level.
Yeah, that's very important. And I know that you talk about fixing the bite because you are also involved in neuromuscular dentistry. And what I find fascinating about that is if somebody has pain, that must just be a terrible cross to bear, but how do you help them get out of their pain?
So I'm a neuromuscular dentist, so I was trained with LVI in Las Vegas. So if your bite is neuromuscularly aligned, then it reduces your back pain, neck ache, shoulder pain, and headaches.
And this is TMJ and TMD that we're talking about too?
It all relates because your jaws are connected to your muscles of your mastication or your bite.
So you work with the patient if they come in and say, I'm suffering from the pain, and you work with them on that.
They don't say I'm suffering from the pain. They just tell me that they have a back ache, neck ache, shoulder ache, and then I check them and I can tell doing some exams what the cause of it is.
Well, that's very important to know because in addition to that, you also do same-day extraction implants, the dentures that we talked about, and conscious sedation. Yeah, how does that work? Because a lot of people need that extra level to get through their dental procedure.
I mean, I do conscious sedation, but I try to wean patients out of it because I want them to experience that going to a dentist is not a place of fear, but a place that'll make you happy. So, and when you're sedated, you don't really know what's going on.
Yeah.
So.
And some people may need that, and it's. What's interesting though is with the mini dental implant, there really is sort of less pain because there's less healing time. And with that, an over-the-counter medication will help, like an Advil or an ibuprofen.
All they really need is Advil and Tylenol, that's it. And it's, doing the minis is very quick. And by the time they are sedated, they're already done. So it's really, best to just get it without it.
Yeah, and this is an in-office procedure, and it doesn't take long, as we mentioned, and custom made for you. And we'll talk about that in just a second. If you're just joining us, we're talking with Dr. Rose Magno from San Francisco East Bay Mini Dental Implants. And they're online, by the way, at sfeastbayminis.com. That's sfeastbayminis.com. The phone number is 510-595-1900. Call or text today to make an appointment. So if you just joined us, we're talking about the mini dental implant and all of the great work that Dr. Magno does. But we should mention, Doc, that some of the patients that you have written amazing testimonials about you. I wanted to read some. Nicholas says, Dr. Rose and her staff were extremely friendly and professional. Catherine, on your website, I would highly recommend Dr. Rose and her dental team. I was nervous about seeing a dentist, and she and her team put me at ease. Sebastian says, amazing. This is a great dental clinic. Dr. Magno is a lovely, gentle dentist. So Dr. Magno, here's a testimonial that gives you 2 million stars. Dr. Rose Magno saved my life. She's very smart, very knowledgeable, and knows her stuff. She was the only one dentist that saw something in my mouth which triggered her to recommend some extra type of blood testing for me. Sure enough, they found what Dr. Magno had suspected. If she hadn't seen whatever she found in my mouth, I'd be dead by now. She asked for nothing in return except for the exam fee I'd already paid her. And by the way, she spent way over an hour or so reviewing my mouth and making sure she didn't miss anything. Dr. Magno is well worth every dollar she charges and more. 2 million stars for her. Cancer is no joke, and finding her made me smile and made me live longer. Look no further. Dr. Magno is the real deal. And I know that you've helped other people as well. You've changed their lives because people come in and they want to smile again. They want to eat food again. And there was an individual who, you shared an interesting story He wanted to come in and enjoy his Chinese food all over again, and it ended up growing into a whole other realm. Share that story.
Okay, so I have this patient who was talking to me and I couldn't understand him because he had a lisp, and I said, well, I could fix that. And he said, you can? I'm 65 years old and I don't know if I really need that. I said, okay, well, it's up to you, but I can't understand what you're saying. So he's like, okay, I'll have you do it, but can I eat this afternoon? Because I'm gonna have a Chinese New Year lunch and dinner and have all kinds of food. And I said, okay, yes, we can do it, and you'll be able to eat and enjoy it. And then the next day when I saw him, I said, oh, so what happened? You know, how did you feel? And did you eat well? He said, oh, yes, I ate well. And I said, well, how about, what did your wife think that you can speak better? And she said, oh, she didn't notice any difference, but my Siri can.
So the technology of Siri understood better than his wife. And I know that people come in and they see you and they now have this trust factor because they know they're getting the best dental care. I think that's very important to note. You know, there's a lot of dentists out there, but when you want the best care, particularly when it comes to the mini dental implant and these other specialties that you do, you want to go to see Dr. Rose Magno. And we talked about some of the patient profile. You have all kinds of people that come through. And when they come in, what do they say when they get the mini dental implant or they have some other cosmetic dentistry? Why is it so important for people to invest in themselves, particularly if they have a job or a relationship?
A lot of times I hear after them done, they say, why didn't I get this done before? It was so easy. There was another time where a patient said, you know, thank you, I got a job from your work. Another patient, the same day I did the work, she got a job because somebody saw her, because she was smiling a lot, and they gave her a job at some movie, but her job was just screaming and showing her teeth.
So she went from not having the confidence to show her teeth to actually appearing in a movie with her teeth. That's a real stretch.
And she got her her husband that day too.
There you go. So everybody's smiling. We're going to talk now about the examples again. And Dr. Magno, I'm going to give you this. So again, show our viewers now, if you're just joining us or you've been with us the whole time, here's the difference between a conventional and a mini implant.
So the hole for the conventional implant is 6 times larger than the prick hole for the mini implants. And you would have to drill at least 6 times to get that hole that size for the conventional implant to fit in. And for the minis, it's 1 time. And you could put the crown or the denture same day, because for the conventional, you'd have to wait 3 to 6 months because it needs time to heal from all that trauma.
When you have a denture, and let's take a look at this, because you call them snap-on, but the mini dental implant gives you that sense of confidence.
A lot of our patients who are wearing these, they are very grateful. They didn't believe that it could happen because look, the thin ridges, they were told that in the conventional they couldn't get it done. But for the minis, because even if with a thin ridge like this, it can be done. And the snap-on into the dentures really makes it very secure.
With the lower, you know, it swims around on the bottom with the goop, and with the upper denture, the palate is exposed, and so the sense of taste comes back. So all the food that you love so much, you can enjoy all over again.
Right. So the main patients that are coming are these patients who are at the bottom. They have been told by their previous dentist that they couldn't get it done, the implant. So they've dealt with the dentures. But as you can see, this has been around for 20, 30 years already, and it has worked.
This is as if you're getting a whole new set of teeth.
For the overdenture with the minis, you still, I mean, it'll be secure, but it's bulky. So if you want to upgrade to something like this, which is a bridge, it's not as bulky. It'll do this, you'll still be able to eat, but this is cemented on and this is snapped on.
So it's a real permanent solution, and it is if you have a whole new set of teeth. And porcelain teeth, and it's made to take a licking and keep on ticking. These teeth really are working.
Well, these are fixed and these are removable.
Yeah, and if you have a single tooth or a side tooth, here's an example, again, that you know, if you have an accident, if you're out with a sports injury or, you know, God forbid something happens, a single tooth gets knocked out or there's some decay, the mini dental implant can fix that. And teeth that are in the back, very important, you can't ignore them.
So I've seen a lot of patients that have a flipper because they are missing a front tooth because of trauma, and they have missing front tooth. And so they've been wearing a flipper for so long. Now we can put on the mini implants, and then we can snap it on with the tooth, and they don't have to wear that bulky flipper that they have.
And it's custom made for you, so you have your smile all back again with a tooth that's custom designed for your mouth. And let's show the side teeth.
Okay, so here's what we call a bridge. It's connected together, but you could also have it single. And we would place the minis and then snap on the bridge or the individual teeth, so it would look like that.
Good as new. How would you suggest that people care for their mini dental implant?
Yes, you could brush your minis and you can still floss.
But you should go back and see Dr. Rose Magno because you want to get a checkup every now and then to make sure everything is in place.
Yes, we want to make sure that you're taking care of your teeth as instructed, and we want to make sure that these will last a very long time for you.
San Francisco East Bay Mini Dental Implants, online at sfeastbayminis.com. That's sfeastbayminis.com. And the phone number is 510-595-1900. Call or text today to make an appointment. Dr. Magno, I understand that your practice is multilingual. What languages do you speak?
I speak Tagalog since I was born in the Philippines, and I also know some Spanish because that's where my culture started from.
Yeah. How important is that there's multiple languages spoken in your practice?
Sometimes some patients are more comfortable speaking their own language, and they want to know that you can understand them and know what they want. So that's why.
I would say that's probably very important. It puts people at ease, no matter what their age. And what inspired you to be a dentist, Dr. Magno?
When I was with my grandmother staying over her house one day, I went to say goodnight to her, and she had her teeth out, and that scared me. That freaked me out.
I bet.
So I asked her, why do you have your teeth out, and how come it's not in? And she said, well, this dentist pulled my teeth because I didn't take care of it and it was rotted. And so from then on, I said, well, I'm going to make sure that I'm going to save my patients' teeth as long as they can.
So your grandmother was an inspiration for you?
Absolutely.
Yeah. Well, God bless. And we should mention Dr. Magno serves everyone in Oakland, Berkeley, Alameda, Albany, Alameda County, Emeryville, on the East Bay side across from the San Francisco Bridge, 10 minutes from San Francisco, and all of these areas can come together to see you at San Francisco East Bay Mini Dental Implants. The phone number, 510-595-1900. Call or text today. And Dr. Magno, you are an innovator in health here in the East Bay. Yes. Thanks for sharing not only your story about mini dental implants and how it helps, but all of the amazing things that you do. And keep on doing what you do.
Thank you.
You're an innovator in health, and thanks for joining us on the show. And thank you for watching.